Thank you. At D24H, we develop novel and effective digital solutions for protecting health. We have 5 research programs led by colleagues from Hong Kong U Medicine, with collaborators from world-leading institutions from mainland China as well as the West. Together, we tackle 6 of the top 10 global health threats listed by the World Health Organization, including pandemics, vaccine hesitancy, and antimicrobial resistance. In the interest of time, I'm going to just showcase the impact of our work on pandemics, specifically the COVID-19 pandemic, which has been our focus for the first 3 years of our operations for obvious reasons. Using advanced data analytics, we provide epidemic intelligence in near real time to support COVID-19 responses in not only Hong Kong, but also in mainland China, as well as other parts of the world. For example, in January 2020, which was the first month of this emergence of the COVID-19 virus, we were the first in the world to publish scientific evidence that COVID-19 was on the way to becoming a global pandemic. We communicated this finding to senior officials in Chinese and Hong Kong governments, who swiftly and decisively implemented dynamic zero control in order to suppress local spread of the virus. As a result, our country was able to protect global health, public health, and societal stability for nearly 2 years until the ultra-transmissible Omicron variants appeared. In December 2020, we were able to show that the Alpha variant, which emerged in the UK, was much more transmissible than the original COVID-19 virus. As a result, when we communicated this finding to the Hong Kong government, they swiftly suspended all flights from the UK in order to prevent importations and buy time to get better prepared. As COVID vaccines became available in 2021, our team was commissioned by the Hong Kong government to monitor the safety and effectiveness of COVID vaccines. Using the electronic medical database from the Hospital Authority and Department of Health, we were able to show that the Sinovac COVID vaccines was associated with adverse events that were not previously detected during vaccine trials. The regulators updated the safety profile of this vaccine accordingly after we have published our finding. When the Omicron variant appeared in 2022 and spread to Hong Kong, we provided accurate epidemic forecasts for the Hong Kong government to respond to the epidemic. Specifically, we showed that even with vaccination, even with the most stringent public health and social measures, our hospital systems would be overloaded due to relatively low vaccine uptake in the older age groups as a result of vaccine hesitancy. In the age of information, vaccine hesitancy is one of the top global health threats because digital advances allow misinformation and distrust to spread at unprecedented scale and speed. Standing next to me is Professor Heidi Larson, who is a pioneer researcher in the field of vaccine hesitancy. In addition to publishing her findings in leading scientific journals such as Nature, she also speaks to world leaders in settings such as the World Economic Forum about the trends and impact of distrust in vaccines, science, and more broadly, new technologies such as generative AI. May I now invite Heidi to share the highlights of her recent work.
Well, we've been hearing a lot about amazing innovation that has been going on here in Hong Kong, and particularly at Science Park. But we've been hearing a lot about the technologies and the issues and the viruses. But the real-world impact is going to depend on whether patients and publics, politics, and the investors trust these innovations. That's what will bring the real-world impact. And what we're doing here as part of our work in Science Park, I founded the Vaccine Confidence Project about 15 years ago when I started to see trends. I'm actually an anthropologist who I've been working in health my whole career, and saw that there was a growing trend of questioning around vaccines. As you know, it's become quite a volatile environment, including here in Hong Kong. I think you had the lowest acceptance of the COVID vaccine among the elderly, which is the opposite in the rest of the world. It was more the younger populations. At any rate, we need to keep our finger on the pulse, and what we're doing here is using large language models and AI to do large-scale social listening. We're monitoring it. We're using it to inform chatbots and other interventions that can give us real-time feedback, and to quickly, as soon as we see signals of any distrust or questioning, we leap in so that we make sure the innovation, the uptake of the technology stays on track. We've been doing this in a number of settings, particularly here, but also being more of a hub we did a multi-site study, for instance, during COVID in Bangkok, in Tokyo, and here, and Singapore, but we're doing it globally, but it's all out of here. And whenever we feature that work, we remind everybody where we do it. And I really appreciate the last session about talking about the importance of promoting the work here. I was in a session with the Minister of Finance at Davos last year, talking about how supportive the environment is here. Not just that you're doing the work and we're doing the work, but how well it's supported. And the more we showcase all the incredible innovations and build the trust, not just in the individual innovations, but collectively, I think it's going to be essential. And my time is up. Anyway, I just want to also pick up on what Bo Hansen said about the importance of value beyond the product, and you're not going to find a more foundational value than the trust and actually actionable action to build and monitor trust. So thanks very much, and thanks for the opportunity and support for this work that we've been and will continue to do together. Thanks.
Thank you.